So I get many questions about hair dyeing and maybe even hair straightening and what's good or bad for your hair. So as a doctor, I always think of it as a tree. So as medically, we're treating the roots and a bit of the trunk, and the leaves and the branches are the hairdressers. Clearly you can see I'm not so good at that part. So dye, to a certain extent, is more of the condition of the actual shaft of the hair. So if your hair is it can cause breaking, it could cause problems with the shaft of the hair. The problem comes in with dyeing or chemical straighteners where it's left on too long or burns the actual follicle or contains harmful ingredients like formaldehyde, and it's getting into the follicle. And I especially see this with ethnic hair, where there's a practice of using straighteners and hair dye, and they're not compatible products. So there's a condition called CCCA, and it's usually a mid-scalp scarring condition that can occur very commonly in ethnic hair from this. I had a boy who decided to go peroxide his hair after matric and did it on the cheap, and that night lay back in the bath and part of his scalp floated past him. And that was a burn. It was a burn from the peroxide. But in general, hair dyes are for this part of your hair, and hair health that we treat as doctors are the roots of your hair. But you need to remedy both to have hair that looks good and strong. With shedding of hair, there's two things lately that have made people shed a lot. So the one was during COVID, so either getting COVID or the vaccine, there was massive hair shedding. I think more than I've ever seen, which was stressful and really interesting, but by now we're mostly over it and have got all that hair back. And the second thing is with the rise of your GLP-1, so for example, Ozempic, Mounjaro, or even having a gastric bypass, there's something when the body experiences sudden weight loss that just makes the people shed.